So when we're working with the deep six lateral hip rotators, we'll need to have access to this outer edge of the buttocks area. And we want to continue to give them some privacy. So we're just going to be cautious about how we do the draping. And I always like to, when I'm moving things around up here, I always like to give an anchor down here around mid-thigh or so, just so that they feel covered, right? That's important. That's part of that trauma-informed piece. That's part of honoring the nervous system of the person who's you're working with. You want to not just whip things around. You want to be real mindful about your draping. So I'm going to have that tucked in right there in that mid-thigh. And if I do it around mid-thigh, then I know that I'm not too close up in their business, which might make them feel a little uncomfortable as I'm tucking things. So I'm going to tuck down here mid-thigh. Then I can take the upper portion and choose how I want to just slide it over a little bit. Now the center of her buttocks, the sacrum center of the buttocks is right here. So we're good to go, right? And then I can palpate right here. I can feel her sitting bone. And then those deep six lateral hip rotators all are right around in this area, from the sitting bone out to the kind of filling the whole posterior of the hip joint and running along the back of the top of the femur as it goes in. So here's that sitting bone, and my work is going to be right in here. Now it feels really good to do some slides to warm this area up. Lots of folks haven't had real particular work in this area. So we just want to make sure that our client feels safe and protected and cared for. And we're just gliding along, doing a little bit of warming. And notice that I'm not going through. Here's that crease of the buttocks. Okay, we're going to bundle it up right next to it so you can always see where that is. And I'm out here, I'm out on this lateral portion of the glutes and getting into those rotators. And I'm not pushing real hard. This is real bumpy around here because there's lots of bony prominences. I got top of the sitting bone is here, back here, here I can feel that top of the femur. So what I like to do is find that top of the femur on the outside, slide up and over it, and right where it starts to level off, that's where those deep six lateral hip rotators are. So I'm going to just move even a little bit more medial so I can sink into that space a little bit. And I'm going to do just some, not a lot of pressure, just sliding through. And come up a little higher. Just really what you're doing is kind of tracing the whole back of the hip socket and down to the sitting bone. How's that feeling, Brooke? You can use some knuckles. Great. Right. And so again, to come up through, come up to the back edge of the femur. I'm kind of in line with the crease of the buttocks here. Here's my sitting bone right here. I can palpate that and feel that that sitting bone is right in there. So from the sitting bone outward, that's where that deep six really lay. So I'm going to sink my thumbs And Brooke, you're going to take a nice deep breath. Exhaling, everything relaxes, everything gets heavy into the table, softening. And I just want to keep riding that edge of the back of the femur and right next to the sitting bone. And how about there, Brooke? Is there any tenderness in there? Nope. And we're just going to keep sinking through. Sinking, sinking, sinking. And then we can angle toward that sitting bone a little bit so that we have something to trap it against. How about there? Little bit, not so bad. And we're just going to strip along here. Then I'm going to slide my knuckles into that space. So it's pretty difficult to isolate which muscle is holding tenderness, right? But we're just looking for something that does feel tender, and she's feeling something a little bit higher. So let's come back to our piriformis point was up here. So we're just going to follow down maybe about an inch or so. And everything relaxing, everything sinking into the table. There you go. Nice job. And how about there? Was that wooey spot? Okay, great. And then I'm just going to hold and sink. Now, Brooke, you can do that internal, external rotation again. So see, she widens that heel out. See how much I sink in? Now she's going to pull that heel back in, and it's going to push me out a little bit. I can feel those muscles contracting. And then she's going to go out. And in. You can see how much my thumbs are moving. I'm really holding the same spot, but I'm following her body. Maybe just 2 more times, my friend. Out and in and out and in. I'm not moving my thumbs at all. I'm just riding her tissue. Okay. How's that point feeling now, Brooke? Does it feel a little freer, perhaps? Yes. Okay, great. So we're going to do a little soft fist knuckle glide again. Not pushing. We don't want to push those knuckles in. Gliding down into the hamstrings. Do a little side glide. Is that okay, that pressure? So you can also hold your client's knee bent. And when you hold it bent, then you can facilitate a little bit this movement. Now the thing is, when we're releasing trigger points, we really want them to do the movement. We want them to activate that muscle and then bring that muscle into a stretch. But this is that movement. So we can just let them stay passive. We can drop that heel outward. That's going to pull that tissue in a stretch and do a little glide. Not a ton of pressure, but just a nice clearing glide. And having that heel pulled out just opens up the tissue a little bit for us. So if we need to, we can sink nice and slowly into that area. Again, it's as if I'm just clearing that back edge of the hip socket. I can feel the femur right under my fingers. I want to slide just above that so that I'm not digging into the bone itself. And just doing a little bit of clearing through there, just kind of sliding, encouraging that tissue to have some length and freedom. Deep 6 lateral hip rotators. Really important to do with any piriformis work that you're doing. And I'm going to set that leg back down, and we'll do one more slide. You can tie it in with the low back a little bit. Lots of soothing. Lots of folks have never had real specific work in this area, so you want to just kind of let them have some nice soothing work through there. Okay, so now we're going to do the other side. When I'm going to move this draping, now I'm going to anchor up at the top to keep it taut as I slide this out and pull it over. See how that just popped right out? But she stayed covered the whole time. So really helpful to keep some tension there so that you can move without exposing. Move that draping without exposing. Great. And now I'm going to show you some different techniques on the other side. So starting with some nice glides. Remember, it's just really helpful to, you can anchor the draping for your client so that they feel protected and covered. We're always wanting to support the nervous system feeling safe. If our client feels exposed or they don't feel safe, they're not going to be able to relax, and those trigger points are not going to be able to release well. So ways that I like to just kind of warm this up, doing some nice glides, and then you can also use your forearm and I'm just riding along, lining my my ulna right through that space in between the ischial tuberosity, the sitting bone, and the back of the hip socket, just sliding right into that spot. And you can kind of just trace it. You could use a soft fist. So other ways to work with it. Coming up, finding the sitting bone. Here's her sitting bone, right at that gluteal fold, right here, sitting bone, back of the femur, right? There's just this little space right in here. So we can just do some nice little tracing, not a lot of pressure. Does that feel okay, Brooke? It's just a small space there in between that sitting bone and up to where that piriformis is. So we're right in this little pocket, this little quadrant right here. And then we can pick up the leg, do a little knuckle slide, relaxed hand, knuckle slide. Can do a little movement with it. Is that feeling okay? Great. And the more I let this heel drop out, the more it opens up that space. I'm going to sink in just a little bit more. Being mindful that there's boniness back here. The back of that femur is right up here at the, right here. I can feel that. The femur I can feel and see rotating. Right? We're just right at that back edge of it. We can keep that knee bent. Sometimes I'll even put my other leg up on the table. Does that feel okay to you, Brooke? I got my foot on the table. Anytime I'm going to put my body or support my body on the table, I'm always going to let my client know, right? And just check in and make sure that that's okay. So now I have her foot and her leg is beautifully relaxed right there. And I could just let my body rock back. It's kind of an advanced movement here. And let that space open a little bit. And I'm just stripping through. Does that feel okay? Great. So remember, our markers are sitting bone right here, outer edge of the femur, because those lateral hip rotators, that deep six, they just pull that back of the femur toward the sitting bone. So I'm going to sink my fingers into that area. Maybe I'm going to use a supported thumb, supporting on my other fingers. And Brooke, I want you to let me know if there's some tenderness in here. I'm just sinking right into that space. Right there. And I can kind of feel I'm wedged in at the edge of that sitting bone. I'm at the lateral edge of the ischial tuberosity, and I'm at the medial edge of the femur. So I'm sunk right into this little pocket that's right there. How's that pressure feeling, Brooke? Do you want more or less? Tiny bit more. So all I'm going to do is lean my body just a little more. How about there? It didn't change much, did it? No. Yeah. So sometimes even when you go deeper, it doesn't change, which might mean that there's just, it doesn't have anything to push against, or that that's just the as tender as that spot gets. So I'm just going to hold this point. She's going to take 2 breaths. And since we know that this spot isn't like really on fire, Brooke, I'm going to invite you to do that little bit of internal and external rotation. You'll see her heel goes in and out. That opens up that space. And oh, it's like trying to push my thumb out as she contracts that. She's pushing into it. And then here, that heel goes outward. Now that heel goes in, I have to kind of wrestle her just a little bit. She went, ooh, yeah, it gets more exciting with that big contraction. Yeah, just maybe 2 more times. I can see her movement is getting a little bigger. And just 1 more. Sinking in. Great, and then relax everything. I'm going to slowly move out, and I'm going to come right back with a little soothing glide, and I might do a little bit more soothing through that area. I'm going to come back to just this forearm, sliding through. Does that pressure feel good? You can always say no if it doesn't. Good. I'm not trying to dig my elbow in. That would be bad. That would not feel good to her. I'm using the broad compression of the ulna right there and sinking. Great. Great. So deep 6, lateral hip rotators.